Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center, joined by Dr. Joseph Gastaldo from Ohio Health, infectious disease doctor and expert. We like to talk to him from time to time on our Facebook Live formats because we get to talk to you a little bit longer, don't have to be restricted, and you can really tell us thoroughly about the latest developments in COVID, and that's what we're talking about today with this Omicron variant. Dr. Gastaldo, can you I feel like this has become a new buzzword within the past 5 days. What is the Omicron variant, and is it something that we need to be worried about? I feel like that's what it boils down to.
Yeah, and again, this is getting a lot of media attention, and it's all in context. The Omicron variant, the latest variant of COVID-19, the virus, SARS coronavirus 2. We have been living with this virus now for almost 2 years. It's the same virus, and we are going to get through the whole Greek alphabet when it comes to other variants. One thing we really want to say is it's all in context. We really don't know that much about it. You know, the Delta variant is still 99% of what we are seeing in this country. The Delta variant is called the super spreader variant. What we know about Omicron is this. This is the most mutated variant that we have seen to date. To put it into context, the Delta variant had 17 different mutations. The Omicron variant has a total of 50 different mutations, 32 of which are at the spike protein. The spike protein is where all the action is with this virus as far as how it binds, how it starts infection, or our vaccines work. There are three unanswered questions that I have and the scientific community is working on. Number one, is the Omicron variant more transmissible? Are people who have it, are they more contagious? Number two, is the Omicron variant associated with a higher severity of illness? We don't know that yet. Number three, do our vaccines still work? Is there any erosion of the immunity you get from a vaccine? We do not know that yet. What we do know is that based on the mutations in the spike protein, antibodies may not work as well. Remember, there's more to immunity than just antibodies.
Mm-hmm. So like you said, I think the vaccine question is the biggest one that people have right now, especially going into the holiday season, spending time, at Christmas with their loved ones. And, maybe if you are around kids who are under 5 years old and they can't get vaccinated at this point, what would your advice be to everybody who is watching, who is concerned about that heading into the holiday weeks?
Yeah, so at this point in time, like I said earlier, what we're seeing in our country is still the Delta variant.
Mm-hmm.
The Omicron is probably here. It's not yet been identified yet. We have 2 cases in Ontario, Canada. But when we talk about the vaccine not working much as far as immunity from the vaccine, it's not a black-white thing. And I doubt very seriously that our current vaccine will totally wipe out all of the immunity you get from it. Now, after you get vaccinated, you have the development of antibodies, and the antibodies may not stick to the virus as much. However, the more important thing for immunity are what we call these long-lasting memory cells. And those memory cells that you get from this vaccine are expected to hold up nicely against the Omicron variant. And these immunity cells, these memory cells, prevent against severe disease.
All right, so I'm reading some comments here, and I think they could be translated into some questions. I'm not sure who they is in this situation, but I think perhaps, I don't know, a scientist or a lab or something. Mike is asking, I think they're still manipulating it and releasing it where they want an outbreak. Is that how viruses work, or is that something that happens naturally, kind of like the flu mutates every single year?
Yeah, absolutely. And again, this is an RNA virus, as is influenza. RNA viruses are very prone to replication errors.
Mm-hmm.
Now, I will say this virus was first identified in South Africa. They do a lot of genetic sequencing there. But we just found out yesterday that based on previous genetic sequencing done in the Netherlands, it was first identified there. So again, we need to pay attention to the Omicron variant. We need to study it, but we really don't know a lot about it yet.
Mm-hmm. Um, we've got some vaccine questions here, and I know Dr. Gastaldo, you can probably answer this for it. Kiki in Ricky's wants to know how many people have died from the vaccine.
Well, the CDC is very transparent on that. If you actually go to Google, type in CDC COVID vaccine adverse events. They update it they update it quite often.
Mhm.
And the last time I checked on it, I want to say there's either 5 or 6 deaths likely attributable to the J&J vaccine. There is a lot of misinformation about that. Everybody's very familiar with a system called VAERS, the Vaccine Adverse Event Reporting System. And many deaths are reported on there because if there is a death at all around the time of somebody getting a vaccine, it has to be reported on there. But just because something is reported on there does not mean the vaccine actually caused it.
Dr. Gastaldo, I know a lot of people are starting to get their booster shots after the guidance came out from the CDC and the FDA about just about everybody should be getting a booster right around this time, since we are at that 6-month mark, at least here in Ohio, where everybody 40 and under could get that vaccine. And that big wave that we saw, I think it was in late spring that we saw that. What is your recommendations on that as people head out? We know that vaccine booster appointments are starting to fill up.
Yeah, so officially speaking, there is a recommendation for everybody who is eligible above the age of 18 that they should receive a booster. Let's dissect that a little bit more. Anybody who has received J&J 2 months after receiving the J&J vaccine, they should receive a booster. Based on looking at information on how the vaccines perform, the vaccine's effectiveness, the J&J vaccine does not perform as well as the messenger RNA vaccines. For the mRNA vaccines, they are eligible to receive a booster at least 6 months out from receiving the second dose. Now, again, let's dissect that a little bit more. And this is me talking as an infectious disease doctor. If you are older, if you are 65 and above, or you have a weakened immune system, you should get a booster. Vaccines don't work as well in those individuals. For younger people, they should get a booster too. And the only thing the booster is going to do for most younger people is essentially top off their antibody levels for the winter months. And with the third dose, we are thinking, and we have to look at this in the efficacy trials, how long those antibody titers will last. Antibody levels will go down, but again, the most important immunity for people to get are these long-lasting memory cells. And these memory cells are what prevent people from having severe disease.
I know you had mentioned there are a lot of unknowns right now about the Omicron variant that has been traced here in North America, up in Canada right now. When do you expect, what do you think a good timetable is to get those questions answered, if the vaccines that we currently have will protect against severe disease from this Omicron variant?
Yeah, days to weeks. We already know that test tube antibody studies are being done. And basically what they do is they take the blood of people who have been vaccinated, and then they create what's called a pseudovirus. They put it in a test tube, and they see how well the antibodies neutralize the pseudovirus with the Omicron variant. But again, that does not capture all of the immunity that you get, and it's quite complicated. But I do know over the next days to weeks, we will have more significant information on all 3 of those things.
Okay. For those out there, again, just want to thank everybody for watching right now. If you have any great questions or concerns, please put them in the comments for Dr. Gastaldo. He's always really good about answering those and making us who aren't infectious disease experts understand what you're talking about, Dr. Gastaldo. So, let's see. Okay, Veronica actually has a really great question here. What about people who had COVID, Delta variant? Do we need to get a booster, or did actually having COVID negate the need for it?
Yeah, so there's a lot in that question. Let's kind of talk about it. First of all, if somebody has had COVID, they should be vaccinated. We know that it's safe. The immunity you get from having COVID is quite variable from person to person, and there's really no objective way to measure it. Antibody tests should not be used as a measure of somebody's immunity. And based on the millions of doses of the vaccines we've given, we know that giving vaccines to people who've had COVID actually gives them better immunity than people who have only been vaccinated. So when it comes to vaccinating people who've had COVID, they need to get vaccinated. If they qualify for a booster, they should qualify for a booster, regardless of whether or not they've had COVID.
Okay. Brenda is asking, why are people still getting really sick with COVID, even if they've had both the, original 1 or 2 shots plus a booster?
Yeah, so there's a lot into that. What she's referring to is vaccine effectiveness. Remember, immunology and vaccines are not black and white. I will use a perfect example of Colin Powell. Colin Powell was 84 years old. Vaccines don't work as well in older people. We still vaccinate them. And Colin Powell also had cancer of his immune system. He had multiple myeloma. So vaccines don't work as well in many medical conditions, and the older you get.
Does that go hand in hand with the younger population, the people who are under 60 years old, under 40 years old, you know, anywhere from 5 up until the elderly? Does that go hand in hand with our generations getting vaccinated to make sure we lessen the spread of that, because they are less affected in those elderly populations and those who have, like you said, different conditions like Colin Powell did?
Yeah, absolutely. And again, younger people have more robust immune responses to vaccines and even from regular pathogens too. But let me see my thing here. But can you still hear me? Let me see. My computer screen froze up.
We can still hear you if you can
Okay,
hear
okay,
me.
okay. I can still hear you, but okay. So back to what I was saying. Younger people do have a more robust immune system when it comes to responding to vaccines. But again, there are many medical conditions that younger people have where vaccines don't work as well. They may be immunocompromised. They may be on a medication. They may be obese. They may have kidney disease. All of those things really impact vaccine effectiveness. Another thing that really impacts a vaccine working better is how much virus is being circulated in the community. When we have more people vaccinated, there are lower rates of infection, and with lower rates of infection, that makes vaccine effectiveness better for everybody.
So, a bunch of kids in the age ranges from 5 to 12 right now. I know they're going to be getting their second shots soon of the Pfizer shot. That time frame is kind of happening right now. What have been some things that we have seen with the kids? Are they reacting to the shots and to the vaccines? I know they're just getting you know, a very small dose. What is it, a third? How have their reactions been like, and how has them getting vaccinated affected the spread of the virus so far? Do we know it yet?
Yeah, it's too early really to say,
Yeah.
but I will say this, so far so good. Kids age 5 to 12 get 10 micrograms of Pfizer. The adult dose is 30 micrograms, but with the availability of vaccinating 5 to 11 years old, that's roughly 27 million more people who are part of the community who are eligible to get vaccinated. Again, kids are low risk, yes, but low risk is not zero risk. And the children are part of the community. And when we get more people vaccinated, vaccine effectiveness for everybody goes up.
Absolutely. All right, Dr. Gastaldo, I think we've answered all of the questions so far today. If we could just have, I guess, one, you know, big takeaway right now for Omicron and this new variant, what would you like the people of Central Ohio to know?
Yeah, so at this point in time with Omicron, don't worry about it yet. We need to take it seriously. We need to study it. We have 3 questions we need more clarification on. Number 1, is Omicron more contagious? Is it more transmittable? Number 2, do people get sicker with this? And number 3, how well do our vaccines work? We will hopefully have clarity on those in the next days to week.
All right, Dr. Gastaldo, thank you so much. Anything else that you would like to add right now?
That's it. I do want to put a plug in for the flu shot. We are starting to see more influenza in the state of Ohio and even in our testing here at Ohio Health. That's a whole wild card. There's something going on with influenza this year. We know that there was a significant outbreak of influenza amongst students up at our friends up north in Ann Arbor. And there's a couple other universities where there's a major outbreak of influenza A. So far in the state of Ohio, we've had 25 confirmed hospitalizations with influenza A, but that's a whole wild card in the scenario of what we're dealing with now with COVID-19. So get your flu shot.
All right, thank you. Hey, actually, if you have a second, Dr. Gastaldo, do you have a few more minutes? We just had some really good questions come in.
Of course.
Okay, Brent is asking, when will an organ transplant, I'm assuming patient, get a second booster?
Yeah, so when it comes to immunocompromised people, specifically those like transplant patients, those people should get 3 doses of an mRNA vaccine. That is considered their primary series. So they would get that 3rd dose at least 28 days after the 2nd dose. Their booster would then be 6 months after the 3rd dose. So that's a great question, and I would encourage that person to really reach out to their pharmacist or their primary care physician to get clarification on that. But people with weakened immune systems, like transplant patients, they are in the rare category of somebody, if you include boosters, should receive 4 doses of an mRNA vaccine.
All right, thank you. Brent, thank you for that question. It was a good question. And then Nicole has one more question. This will be our last one for you. Does asthma play a role in a person getting a shot? I'm asking because my child's father says he has asthma but has never been diagnosed by a doctor, so should he get one?
Yeah, asthma is a lung condition, and people who have underlying lung conditions, including asthma, COPD, emphysema, those people are at increased risk of having a bad outcome or severe disease with COVID-19 and influenza. So if somebody is listening to this and they do have asthma, I would strongly recommend that they receive a COVID-19 vaccine and an influenza vaccine.
All right, that will be the last question for now. Thank you so much, Dr. Gustato. We appreciate it. We have more information, what we know, the unanswered questions, basically everything you need to know on NBC4i.com. Those are trusted sources. Everything links back to infectious disease doctors like Dr. Gustato, the CDC, verified health studies is what we link to, and everything you need to know can be found on NBC4i.com. Thank you, Dr. Gustato, for your time as always.